Alright, so in this video we're going to be doing our cross-fibering recipe for the upper back. We do our back muscles in two different recipes, one for the upper and one for the lower back. As part of our recipe today, we're actually going to be even doing work in the neck because some of the muscles that function in the shoulders actually begin their attachments in the cervical vertebrae of the neck. So the first actual muscle that we're focusing on today is going to be the levator scapula. Levator scapula's origin is on the C1 to C4 transverse processes. When we come to the table to do this work, we're going to have the client face down. I'm going to take my bow stance, and I'm going to face my bow stance across and just a little bit up the table. And what I'm going to do is I'm going to go ahead and lightly kind of bring the client's hair up to expose their mastoid process. As I palpate here, the mastoid process is very identifiable. We can use it to find the transverse processes by going to the very most inferior part of it and going just a little bit anterior and going deep to where the mastoid process is. Now, what you're trying to do is you're trying to feel for a bone that's as close to the surface of the neck as possible. So you don't really want to be sinking very far in. You want to look for the most shallow spot that you can feel for. Once you find it, you're probably, if you're next to the mastoid process, you're probably on C2. So we can do a cross fiber here, thinking about the origin of levator scapula. If we wanted to do C1, what we can do is we can bring our pressure up a little bit more superiorly. In truth, most of the time C1 isn't very accessible, but we can still kind of send our intention and our technique. We can kind of send the intention deep to the C1. Once we've done C1 and C2, we can move lightly down to work on C3 and C4. Remember that in order to make sure that you're getting this muscle, it's really important that you find the bone that's most shallow, that's closest to the surface of the skin. Once you've gotten C1, 2, 3, and 4, the origin of levator scapula, you can think about doing broad cross fibers as we bring it down to its insertion. It's going to go deep to the trap, so you can kind of see how I'm kind of lifting up the trapezius and trying to cross fiber underneath as we try to look for it to go down to the superior angle of the scapula. Once we've gotten the origin and the insertion on this one, we can consider the levator scapula treated through a cross fiber, and we're ready for our next move. Great, so our next move is going to be working on the upper trapezius, followed immediately by working on the supraspinatus. When we do the upper trapezius move, what we're going to do is we're going to step around over the side of the shoulder that we're working on, and we're going to stand in a bow stance. Now my forward leg is always the one that can go around the corner of the table. What I'm going to do is I'm going to take my elbow, I'm going to lock it on my hip, and I'm going to make a fist. And now I'm going to take that fist and I'm going to scoop the trapezius, locking it onto the shoulder. And I'm going to use my stance to create a forward pressure, and I'm going to use my stance to bounce and create a cross fiber here. Try to keep your wrist as straight as possible. You don't want to see your wrist in a sharp angle while you're doing this type of a lock. So try to keep your wrist straight and relaxed as possible. Once we do our cross fiber closest to the neck, we'll slowly bring it out over the shoulder and closer to the acromion. As you get towards the edge of the shoulder, it often feels a bit more bony, so just watch that your knuckles don't clack onto their bones. It's pretty uncomfortable. Now, as an alternative, I know that some people aren't very comfortable doing a hip-locked elbow, so you could potentially also stand at the side of the table. We're going to use a bow stance facing this way. We're going to lock our hand in a bar over the trapezius, and we're going to sink our stance back like we're trying to sit on our back leg. Once we've created a pull lock through our stance, we'll balance our stance, and we can do a cross fiber this way as well. Okay, now regardless of which one of these two techniques you decide to use, we've got the upper trapezius cross fiber, so we're going to move on to the supraspinatus next. When we work on supraspinatus, it's important to remember that it is underneath or deep to trapezius. So as we approach the shoulder for this one, what we want to try to do is be mindful that instead of going through the trap, a lot of times we can kind of pick that muscle up, lift it up, and you can kind of see that fold of tissue here. We can lift up trap, and then underneath it, we can slip into the supraspinous fossa. And it's in here, we'll go ahead and use supported thumbs here, and we'll create a cross fiber by compressing the thumbs in. Once we've created a lock on those tissues, we can use our stance to create a cross fiber. Now in this particular case, I have placed my rear leg down onto a knee. My front foot is still on a foot. so I can still use my stance to create this movement instead of using my shoulders. As you work on this one, again, stay in supraspinous fossa and work your way progressively closer to the acromion. Okay. Once you've done that, we can consider the supraspinatus, to be well cross-fibered, and we'll go ahead and move on to the next move. Okay, so the next move that we're going to be doing focuses on the rhomboids. If you haven't already undraped the client's back, you can do so now, bringing the sheet down, at least to see the upper back. When we work on the rhomboids, we're going to start at the origin. The rhomboids are originating between the C7 and the T5 spinous process. So those are the bumps that point straight out the back of the body. C7 in particular has a little trick that you can use to find it. When you touch the back of the neck and you stroke down the back center where you can feel the bumps of the spine, the first bump that sticks way out farther than the others as you're coming down the spine is almost always C7. So you can use that as a pretty reliable way to find that spot. Once I found C7, I'm going to go ahead and come around. I'm going to take my stance. My bow stance is going to point across the body. I want to remember that the fibers of the rhomboids are going this way, so my cross fiber is going to go perpendicular to them. Starting at C7, I'm going to make my contact. And the last thing I want to remember is I have to sink deep. The first muscle I'm touching is trapezius, but I have got to go through trapezius in order to cross fiber the rhomboids. So remember to sink your pressure in deep to go to that second level. And then we're going to cross fiber the origin starting at C7 and progressing slowly down to the origin at T5. Okay, once we've done that, we can come back up and look for the belly of the rhomboids. Again, still deep to trapezius, so make sure you're sinking your pressure in a little lower. And progressively moving in to find different spots of the rhomboids. And then we're going to go into the insertion, which is on the vertebral border of the scapula. Try to palpate and know exactly where this bone is so that way you know where the insertion is. Once I find that, I'm going to find the vertebral border. Again, I'm sinking down to the rhomboids and cross-fibering in the same direction that I've been doing this whole time. Following the vertebral border of the scapula. Good, and remembering that we don't actually go all the way down to the inferior angle. If you've gone all the way down to the inferior angle, you've probably fallen off the rhomboids a little bit. So right about here, if this is the inferior angle at this spot, this is probably the last spot where I'm going to find rhomboids. Great, and with that we've gotten the insertion of the rhomboids. We're ready to do the second side, and then ready for our next move. Alright, so the next muscle that we're going to be working on in this recipe is the serratus anterior. In order to access the serratus anterior, we're first going to have to make sure that the body is positioned in the right way. So in this case, what we're going to do is we're going to go ahead and move the drape to expose the arm, and we're going to bring the arm off to the side of the table. Once we have the arm onto the side of the table, we'll go ahead and take our position. Our bow stance is going to be face up and lightly across. And our goal here, the serratus anterior, is actually going to be on the upper 8 lateral ribs. What we want to do is we want to use the hand that's not doing the work. In this particular case, my inside or my right hand is going to take the lat and the tissues at the back of the body, and it's going to lift them up. What that's going to do is it's going to give access to the serratus anterior to my left hand. Now my left hand can go in and make contact directly with the ribs. I want to remember that the serratus anterior is attaching at its origin at the anterior upper 8 lateral ribs. So we're going to follow the ribs just a little bit anteriorly towards the front of the chest. When we make contact with the rib surface, we can go ahead and begin a light cross fiber here. Just to kind of give you a heads up, this hand isn't doing anything. It's only my left hand that's really creating this cross fiber. My right hand or my second hand is just creating a lift, so that way the lat doesn't get in the way of this movement. Now we can continue to do cross fibers on the side of the ribs, going deep under the armpit, remembering that the origin is all the way up to rib number 1. So sometimes you can do this, other times it can be a little too sensitive for the client. So always kind of check in, make sure the client's open and that they are able to receive that work. And when you finish cross fibering all of the upper 8 lateral ribs, you can even come back just a little bit more posteriorly and kind of work the ribs as they work towards their towards the scapula. So that gives us access into the serratus anterior. So that sets us up to be able to do the last move, which we'll show in just a moment. All right, so we're ready for the next movement. The last two muscles that we're going to do are going to be here. We're going to work on first on serratus anterior, and then we're going to work on subscapularis. In order to make sure that the person is able to receive this work, we're going to have to modify the way that they're laying on the table. In this case, what we're going to do is we're going to go ahead and undrape and put the arm out to the side. That opens up the lateral ribs as well as access to the scapula for us. We're going to take our stance and we're going to make a bow stance that's facing in towards the table and up towards the head. And what we're going to do with our offhand, or one hand is going to do the work, one hand is going to be supporting. The supporting hand here is going to take the lat and it's going to gather and lift, and the second hand that does the work is going to find the lateral ribs. Now remember that as we work on the serratus anterior, we want to work not in the gaps, but actually on the ribs themselves. So as you feel onto the ribs, we want to go just a little bit anterior towards the front of the chest. We're going to find the top surface of a rib and we're going to give that area a light cross fiber. Now this spot tends to be pretty sensitive and sometimes even ticklish, so be mindful of the pressure and the amount of movement that you're using. Often again, this hand isn't really doing anything except for lifting the lat. Okay, as we do the ribs, we can keep moving up the ribs. We can go very deep under the armpit because the serratus anterior goes all the way up to rib number 1. So as far as you're able to access or as far as the client is willing to allow you to work, you can take this move way up the ribs for serratus anterior. Once we're done with serratus anterior, we're going to use this same posture to access the subscapularis. Now we're going to use both of our hands. There's two ways to do this. One is going to be with supporting thumbs. What we do with this move is we take our thumbs, we scoop underneath the lat, and we send the thumbs like they're going towards the neck, and then we kind of curl the thumbs up so that way we can cross fiber the subscap on the anterior surface of the scapula. The second move that we can do is one hand can lightly lift the lat and the other hand can turn itself face up, so that way the soft finger pads are facing up towards the subscap and we can access the subscap that way as well. I'll show the thumbs first. Again, notice how I'm kind of walking my thumbs underneath. I don't want to overstretch the skin here, and I'm definitely scooping way underneath the latissimus. If you try to go through the lat for this move, you will not be able to reach the subscapularis. Now that I'm here, my thumbs are hooked, lightly rising up into the subscap, and I'm pushing them towards the neck, almost like I'm trying to reach the neck, but I'm just creating a light cross fiber now on the subscapularis. So that's one way with the supported thumbs. Again, a second way would be to use one hand to lift the lat. We turn the other hand to face up towards the ceiling, and we take the finger pads, the soft finger pads, and we kind of feed them into the subscapularis spot. Once we've made contact, we can use our body to create a rock. Now when I do the technique this way, one of the things that I'm doing is putting my wrist on the table and kind of popping my wrist up. It's almost like a beckoning type of a movement with the palm, and that means that the arm can be relaxed even while we bring pressure into the subscapularis, and we can use our stance to create a light cross-fibering rocking motion. Okay, once we've done subscapularis, we're done with this side of the body for cross-fibering. We can do the work on the second side to finish things up, and that'll finish the cross-fibering of this particular recipe.